Well, it's 1 o'clock, so we're going to get started. And I want to just thank you, everyone. Thank you for joining us today at RiverWoods Durham as we continue our commitment to bring educational topics for caregivers and families. I'm Kelly Fires, and I'm the Senior Living Counselor for Newfound Lodge at RiverWoods Durham. And before we begin, I'd just like to take you to a moment to tell you about Newfound Lodge. In our next slide.
Sorry, Kelly. Okay, there you go.
Yes, thank you so much, Tami. Newfound Lodge at RiverWoods Durham is our brand new health center that will be opening this fall. And it will offer assisted living, enhanced assisted living, and memory support. Our traditional assisted living that you can see here will have 24 1- and 2-bedroom apartments with kitchenettes, full baths with walk-in showers. The apartments are really designed to foster continued independence for residents who require some assistance with activities of daily living. And these are things such as medication management, bathing, grooming, and dressing. We'll offer different levels of care, including enhanced assisted living, which is really our highest level of nursing care for residents that really require full assistance. We will have 12 private suites in our enhanced assisted living. And on the next slide, I just want to show you a little bit about our memory support community, which will offer 24 private suites, again, with all private baths and walk-in showers. And what's wonderful about our small household is that this is a new innovative design. And again, it's called the small household design. So each memory support small household neighborhood will include 12 private suites that surround a shared living room, dining room, an open kitchen concept, which you can see a picture here, which really fosters a more home-like environment. The memory support program provides individualized care and services for residents with Alzheimer's or other dementia or cognitive-related decline. People living at Newfound Lodge will have access to 24-hour nursing services, dining services, daily educational and recreational programs like what we're having today, and many other services and amenities. Person-centered care is what RiverWoods is known for. This is very important to us because this enables us to really help each person reach their highest level of independence, no matter where they live. But there's much more that I'd love to share with you. So on the next slide, I just want to provide my contact information. If you know someone or have a loved one who could benefit from more support in their daily life, please tell them about this opportunity at Newfound Lodge. Again, please, you can go to our website or contact me. I'd be happy to speak with you and answer any questions that you have. And again, I want to thank you for joining us today for this very important educational topic. We're so excited to offer this to you today. Walking health is paramount in Parkinson's disease. And I'd now like to introduce our speaker today, Tami DeAngelis. Welcome, Tami.
Thank you. Thank you so much. So I'm very happy to be here. I'm a physical therapist from Boston University, and I work at what's called the Center for Neuro Rehab. And at my center, we provide both clinical care and we participate in research with the goal of advancing the knowledge of exercise and physical therapy interventions for people with Parkinson's. So we can be reached if you are involved in social media. We can be reached through Twitter, Facebook, or Instagram. And you can also do the old-fashioned way of calling us. And I have a number right here. We're also part of a helpline. So the American Parkinson's Disease Association National Rehab Resource Center. And so you can call us if you have any questions after this presentation, or you'd like to find out more about accessing exercise opportunities in your local communities, we can help with that. And then that is also our email. We are a small organization, so I'm the one who answers that phone and the email. So if you have any questions directed towards me after this, please reach out. So I'm going to get started today. We're focusing on walking and the importance of walking for people with Parkinson's. And before I get into some of the research behind why walking is so important with Parkinson's, I want to just distinguish the difference between physical activity and exercise. And this is particularly important right now, as many of us are still under stay-at-home measures or still safer at home because of high-risk populations. But both of these sort of areas have taken a hit, certainly with COVID-19. And I think physical activity we describe as just you're moving around during the day, running errands, gardening, just activities that where you're not sitting and not watching TV. So non-sedentary activities. Where exercise is distinct from that because it's planned, it's purposeful, it's with the intent to get either a cardiovascular or a strength training benefit from some activity that you're doing. So these are two distinct things. Both are very important. And as I mentioned, COVID-19 has certainly had an impact on both because we're not going to doctor's appointments or the grocery store or other group activities or meetings. We've had a decrease in physical activity. And then for many people, because you don't have access to gyms or senior centers where you might exercise, the exercise has dropped. So this is critical to what I'm talking about today, because one thing we can do is go out for a walk. Depending on where you live, you may or may not need a mask for that, but essentially that is available to us. So I want to talk a little bit about why walking is so important. And I looked at a study that looked at many people with Parkinson's, and they rated the symptoms that they felt were most important to address in treatment of their Parkinson's. And so what came out on top was walking. Also highly rated of importance was slowness, difficulties with ADLs, and fatigue. And interesting also what came out in this survey was that walking, they have low outcome expectation for improvement of their walking. So not only did I identify walking as one of the most important things they wanted addressed in treatment, they also answered that it was one of the things that they thought would probably not be able to be improved with treatment. So I'm hoping to highlight the importance of all the things that we can do to intervene with walking with Parkinson's and improve it. So this is a very busy slide, but the key important thing on this slide is that walking and exercise are wonderful ways to manage Parkinson's disease. Obviously, medication management is another critical factor in managing the symptoms of Parkinson's disease. So together, these two things work well. I just want to highlight with this slide, this was a study done by Faye Horak, and they looked at the different components of walking and how they were impacted by Parkinson's disease medication, so Sinemet. And what's interesting is that while many features of walking are improved by medication, if you look down at the bottom of the slide, those features over to the left that have more to do with the balance were not impacted as much in a positive way by medication. So what's important to this is that while medication is helpful in some areas of walking, it impacts possibly stride length, arm swing, trunk rotation, all those things that can have a positive impact. But then there's balance where it doesn't. So it's really important to be addressing the balance difficulty with walking through exercise and activity. Another important part I want to talk about is came from a study that we actually did at Boston University along with colleagues across the United States. And we followed people for 1 year. So we didn't do any intervention. We didn't tell them to do physical therapy or not do physical therapy. Some were exercisers, some were not. But what we found is over that year time when we tracked them, there was a 12% decline in steps. So over a year's time, their average number of steps had decreased by 12. So that's a pretty significant amount in a year without any other factors that came out as influencing that. And then the other key piece of this was that there was a 40% decline in moderate intensity steps. So it wasn't just that people with Parkinson's over a year were walking less, it was that they were walking at a slower, sort of less intense speed. And what we know about intensity of walking is that it's important to have variable walking speeds, and just for cardiovascular benefit, it's important to have some moderate intensity steps. So this is just an indication that there's certainly room for improvement, and just the natural history of the course of people living with Parkinson's, we're seeing a decline when we actually don't have to. We can certainly intervene here, and the next studies will support that. Before we get to this, the next 2 slides I want to talk about are demonstrate the importance of addressing walking and getting treatment for walking early. So in this study by Schulman, they looked at walking changes and correlated them to changes in quality of life or function and disability. And they actually found that early changes with walking were a red flag to emerging disability. So before sometimes even the person experiencing a change with walking, it was appreciated on tests they were doing in a research environment, they were finding that after that there was some sort of change in the level of disability. So they were having more difficulty with other things. So what this speaks to is that possibly if we can intervene early with walking, we possibly could prevent that sort of emerging disability that comes later with that. Another study, this is by Sue Lord in the UK, they looked at these changes in all different phases of Parkinson's, but what came out was that we're seeing these changes in time spent walking and total number of steps, even in the very early stages of Parkinson's. So that's HMY1, so the Hone and Yar scale. It's a scale of disease severity. So even when people had very minimal symptoms, may or may not have been taking medicine, may have only had symptoms such as tremor on one side, already we were seeing a decrease in their walking. But like I said before, we don't have to let this happen. So there's many things that we can do to improve walking, to maintain the number of steps, and to maintain function, and hopefully quality of life through all of that. So this was another study, and it looked at 2,252 people with Parkinson's. And it looked at the regular exercisers and the low exercisers, or is this picture shows you the couch potatoes. And so it found that people who were regular exercises at baseline had higher measures of quality of life, better mobility, improved physical function, better cognition, and less disease progression 1 year later. So we don't have to go on the trajectory of a decline. If we intervene, participate in exercise, move our bodies, we can certainly experience improvement. This was another study, and I just highlight this because we get so many questions about what should we do for exercise. Is it better to swim, do boxing, do walking? And the answer is, it depends. It depends on what you want to improve upon. But this study looked at 3 different types of exercise. It looked at low intensity treadmill training, so walking on the treadmill, high intensity treadmill training, and then strengthening and stretching exercises. So people in all 3 of these groups in the study improved, which is great. However, they all improved in different areas. So the people in the treadmill training groups improved in walking and endurance. The people in the strength and stretching program improved in strength. And the people, then when you compared the low intensity and higher intensity exercise group had better effects for their cardiovascular system. So it's called a training effect. So you will improve on what you work on. So it speaks to the fact that a good exercise program has some balance to it. It might have components of all these different things to get the most benefit. This was another study by Ook, and it was a community exercise program. So this is a great study because it wasn't in a lab, and it was outside walking like we all could do. So very accessible. So walking 3 times per week for 45 minutes in the community setting, and everyone wore heart rate monitors to help make sure that they were getting to that moderate intensity. So we talk about that as somewhat hard work. And that's where we know that threshold where you're really going to get an effect from the walking and get some benefit from it. And they saw significant improvements in this group of people who participated in the program. So given all this information, so just to sum up what I've presented so far. So the research shows that walking is really important to people with Parkinson's. People with Parkinson's aren't actually very confident that their treatments are necessarily going to have an impact. So it should highlight to physical therapists, neurologists, primary care physicians that this is an important thing in treatment and we should be talking about it and addressing it. We also know that medicine helps with some aspects of walking, but not all aspects of walking. And then also that if we don't do anything, there's some evidence that over time, there will be less walking and less intensity to the steps. So a decrease over the long term. And again, that study was just over a year. So over 5 or 10 years, we would expect quite a big decrease if we don't intervene. And then hopefully some of those studies that I showed you give the evidence that we can have a great effect if we intervene. So different walking on the treadmill, walking over ground has great effects. Doing strength training has a great impact. So all of these things, we can reverse this sort of trajectory of a decline with walking in Parkinson's. And, not only make it a straight line where there's no decline, but even possibly make it on the up. So improvement. So this is great news. So now I'd like to give some practical advice and talk about how you can improve your walking at home. And we'll talk about some other different tips in a minute. But one thing to do is to not try to do too much at once. So if you're going from not participating in walking at all to wanting to start a walking program, maybe some of you will be inspired after this, hopefully. You want to start with short bouts, even going for a couple of minutes a few times a day, and aiming possibly to more target that physical activity domain instead of that exercise domain. So just getting up and moving more throughout your day and increasing your physical activity would be a great place to start. Finding a walking buddy is always helpful. Someone that would make it more enjoyable for you, preferably someone who walks a little faster than you rather than slower. And so if you're someone who likes to socialize, you can sort of tap into that aspect of something you enjoy to make it more pleasurable while you're walking. And then another key thing if you want to get started on your walking program, is to consider the time of day and your medication schedule. So you want to walk when you're feeling your best. You want to walk when your medications are working their best. So it's important to give that some consideration. A lot of people I work with find that midday is best for them. When we start to get into the warmer weather, and you might need to either go in the earlier part of the day or the later part of the day, it's important to consider that. And if you need to speak with your neurologist in terms of managing your medicine to optimize your timing and ability to walk, that's something to consider as well. So one thing that people find very effective to help with walking is to get an external cue. And so often we use music or a beat as a cue. And so in this video, you can see the gentleman walking without RAS, which is rhythmic auditory stimulation, which just means an external rhythm. And he's a little bit slower, a little bit more shuffling to his gait. And then in this next video, we have a little bit of music. It's going at 116 beats per minute. And you can see just some characteristics of his walking has improved, most significantly, the speed of his walking. So at home, you could certainly do this. You could, on Amazon, you can buy a little metronome. If you have a smartphone, you can download an app with a metronome. And this external cue is very helpful in Parkinson's, because for some reason with Parkinson's, there's this decrease in automatic movement. So there's loss of automaticity. So whatever drives us to maintain speed in Parkinson's, for some reason, that amplitude is decreased. So having an external rhythm can really help you maintain the speed and therefore get that both benefit of practicing walking, but also the cardiovascular benefit, which is a challenge for many people with Parkinson's, to get up to a speed enough to actually feel like you're exercising. Here's another video that looks at that freezing. And you see, if freezing is a difficulty for you, there's a bunch of stuff you can do for external cues, and most of those are visual. So it's helpful sometimes to put tape on the floor if people have tried that. So in your own home environment, you can put tape on the floor and walk through the lines. Many people may have heard this suggestion before. Sometimes the music and the beat can also help with freezing. But freezing is a complicated problem. I wanted to bring it up in case it applies to anyone. It's probably best to see a physical therapist who has expertise in Parkinson's. And that number I gave you earlier, I can help you find someone if that's the case. But again, it's a complicated problem, but many times we can improve freezing and give you the ability to walk and walk for exercise again. And here is the effect of the lines when it's effective. So you can see that nice, smooth walking pattern. It's interesting. We don't actually know why this works. That freezing, as I mentioned, is complex, and it's thought to be a combination of a visual issue, a cognitive issue, a motor issue. So it's all sort of combining and causing a freeze. This certainly gets at a visual. It's providing some visual input on the floor, and that's why it is thought to be so effective. So we get so many questions about assistive devices, and I usually talk with people, it's more on an individual basis. They certainly have their role in Parkinson's. Assistive devices can be more tricky in Parkinson's than the general population because they require what we call dual tasks. So you're required to do two things at once. When you're managing a cane, for example, there's a sequencing involved, and you have to focus on the sequencing, where the cane goes, what you're doing, while focusing on walking at the same time. So if you're someone who does have issues with freezing or issues with your balance, you're adding just a little bit of a complexity. And sometimes that can actually make walking more difficult, and sometimes it can improve it. So it's a very individual thing. One thing that people do have good success with is the Nordic poles. So earlier in disease stages, if you don't have freezing, Nordic poles are great because they help us to walk with a more reciprocal gait pattern. So that means opposite arm and legs moving. And it gives a little bit of a touch point to the ground for people. So it helps a little bit with that feeling of being less balanced. And Nordic poles have given a lot of patients that I have worked with sort of the ability to get back out to hiking, going to grandchildren's soccer games and stuff. So more uneven surfaces. So there's definitely, all these devices have their use. It's just important to meet with a physical therapist or someone who knows about both the pros and the cons of using assistive devices with Parkinson's. All right. So what gets in the way of all this? So hopefully I've convinced you that it's important and that we can have a great effect, and walking and exercise will help you manage your Parkinson's. But why don't people do it? You can see this cartoon, people call it the dreadmill, the Nordic trick. So a lot of people don't like it. So lack of enjoyment is one of the biggest barriers to exercising and not doing it despite knowing that it's good for you. So how do we combat that? Well, we have a couple of strategies. We've sort of reached into the domain of psychology and sort of behavior modification, behavioral change, and kind of looked at what components can help people feel better about exercise and truly make it a habit. One thing is support and coaching. So at our center, we actually did a study on peer support. So there's a lot of information about peer support and having other people involved to motivate you, to support you. And that can be, like I mentioned before, a walking buddy. It could be a leader of an exercise class that you take. It doesn't have to be a formal coach or personal trainer. It can really be anyone, but just someone who's looking out for you and supporting you in your goals to exercise is very important. Having a goal is important. Kind of looking at a goal as something that's actually important to you. So it depends on who you are and what you value. So if traveling with a loved one is important to you, and in order to do that, you need to be able to walk a certain distance. That would be a valuable goal. Whereas like for me, setting a goal as a marathon is not going to be a valuable goal. So it has to mean something to you. in order to make it a motivating factor. And then goal setting goals that can be, or we call them SMART goals, that are achievable and realistic, and starting out small, not setting huge goals. So one goal that I've actually talked about with people is not even actually doing the exercise. It's waking up in the morning and putting your sneakers on. And that takes away that one barrier of, they're already on your feet and you can just head out the door. So really, the goals don't have to be huge and overwhelming to be very effective. And having an action plan. So actually, when you decide you'd like to move towards a more regular exercise program, actually deciding, all right, so who am I going to go with? Am I going to do this alone? Do I need to get a ride from someone? Like what people are involved in this? What am I going to do? What will I enjoy? When am I going to do it? And where am I going to do it? And it's been shown that if you actually write these things down, you're much more likely to be successful in accomplishing it. And then intrinsic and extrinsic motivation. So this speaks to where the motivation comes from. So extrinsic is outside of the individual and intrinsic is inside the individual. And what's interesting about this is that oftentimes, and I capitalize on this as a physical therapist, a lot of people will exercise because I've told them to, and they don't want to come back to a physical therapy appointment and tell me they haven't done it. But over time, we move from having it be extrinsic to they're doing the exercise because I told them to, but then they start to feel good. And then they kind of start to wake up and say, oh, I want to feel better at the end of the day, so I'm going to do it, not because Tami would be disappointed in me. So we shift from extrinsic to intrinsic, and that's very critical. And then making it a habit. If you can make it a habit, like brushing your teeth, where you don't even question whether you're going to do it or not, and we take out that thought of, well, it's kind of rainy today, I don't think I'm going to do it. No matter what, we almost all brush our teeth before we go to bed. So if we could make exercise like a habit like that, it would be critical. The other thing and I had mentioned the psychology of some of this, we talk about the way our thoughts get in the way. And this is, again, in line with some behavior change research that we've looked into. But it's the way we think about exercise and the way we can we call them excuses, but we talk ourselves out of it. We have thoughts that don't support exercise. So something like if you were to start an exercise program and you did it for a week, and then Monday came and went and you didn't exercise, Tuesday came and went and you didn't exercise, and then by Wednesday you're thinking, oh, this is just me, I always do this, I'll just start next Monday. So that kind of thought doesn't support exercise. And so we talk a lot about the way your thinking impacts your behavior around exercise. And there's actual thinking traps that we can identify. So all or nothing thinking, fortune telling. So example of fortune telling is like, I'll never be an exerciser, I never have. So that's not a helpful thought, right? That's not going to encourage you to exercise. And then labeling is similar to that. So I'm sort of identifying yourself as not someone who goes to the gym. Even though you could be a gym goer, you say, oh, I'm not, that's not for me, I'm not a gym goer. So you're sort of giving yourself a label that doesn't encourage you to partake in an activity or a behavior. So to summarize this, and I'm going to be wrapping it up, you want to set a goal that is meaningful to you. You want to create an action plan, make it a habit if you can, and then consider your role of the thoughts. Just notice your thoughts around exercise. Every time you get ready to go, are you having thoughts that support your participation in exercise or discourage it? And then get support. Seeing a PT is a great way to get started. Right now, a lot of the PTs or local PTs to you might be giving virtual visits and telehealth. And I think in the next, hopefully, 3 to 6 months, we'll be back in operating, but who knows? But the telehealth option is there and has been approved by Medicare. So that's a great opportunity for everyone right now. And then I just briefly want to mention this in terms of seeing a physical therapist. I think it's really important that you don't just go for a problem. So people have probably seen physical therapy for a shoulder pain or maybe after a knee replacement or hip pain. The way we work with our patients at the Center for Neuro Rehab is that I see everyone just about every 6 months, just as you would your dentist, for prevention. So we'll review your exercise program. If you haven't been doing it for a few months, we'll get you restarted on it in a reasonable way. And so this just helps us, just as you see your neurologist every 6 months, and they may adapt your medications. A physical therapist would adapt your exercise program. So working together to help manage the Parkinson's symptoms. All right. So another summary. So different modes of walking are beneficial, starting in small bouts and increasing over time. Walk for more minutes and walk faster. And you get greater benefit from setting goals and getting feedback. All right, so in just a minute, Kelly is going to join me back here and we'll field some of the questions in the Q&A and also some questions we received beforehand. And while she's coming back on, I just want to say thank you to my team at BU. It's a group of researchers, students, clinicians, and everyone's awesome. And we get to do a lot of great things because we have a great team. So, all right, I will go to the next slide. And Kelly?
Okay, well, thank you so much. Before we go to the question and answers, I just wanted to remind the audience for next week, we're having a webinar as well from Jack York, who is the co-founder of It's Never Too Late, and he'll be speaking about redefining dementia, finding joy along the way. So again, I think that's going to be another wonderful topic. It will be next Thursday, June 11th at 1. So please call to register for that as well. So, and again, thank you. And okay, now I'd love to take some questions from our audience. Okay. This is a great one here, Tami. What is the first sign of Parkinson's and when should people start being concerned about it?
Oh, that's a good question. So there can be many different signs, and they've actually studied this, and some of the non-motor signs are the earliest to come about. So even dating motor signs. So motor signs, when I speak of motor signs, I'm talking about things like tremor or difficulty walking. But there are some motor signs. They're doing a lot of research into loss of smell that occurs and predates motor difficulty by a lot. And there's also other signs like some people have some difficulty with anxiety and depression many years prior to a diagnosis. So those are some early signs that they're looking at. I think there's some pretty typical earlier signs that we hear about from patients it's often a spouse noticing a change in the walking, maybe not taking as big of a step or maybe not swinging an arm is common. Small handwriting is common and tremor is common. So those are all things that people notice early on. And that if you are concerned about it, certainly speak with your primary care physician or a movement disorder specialist.
Okay. And there's another question, which I think is a great question. We saw that video of the gentleman where they placed the lines to help him stop freezing. And the question is the laid out lines on the floor. What is the optimum distance between lines?
Oh, that's a good question. I have that not readily available in my brain, but readily available on my computer. I think it's 12 inches apart, but I could double check that. And whoever is asked that question, it's an excellent one. I will, if you email me at rehab@bu.edu, I can send you that answer.
Okay, great. That's very specific. So thank you. And also too, someone just said, can I rewatch this later with my siblings? So I did just want to remind the audience, yes, we are recording this today. So we will repost this on both our website and Facebook page. So if you have a loved one or again, family member, somebody that you would like to, rewatch this program, it will be available to you. Okay. And another question here, this looks like a good one here. I can only walk a few minutes before needing to rest. So I don't go for long walks. Is there anything I can do?
Yeah, so I think so there can be many, so it's not just Parkinson's. So, people with Parkinson's also might have difficulty with their cardiovascular system, their pulmonary system, their musculoskeletal system. So it's important the Parkinson's itself shouldn't limit your walking. So there may be something else going on. It may be a medication that you're taking. So it's important to speak with your doctor if you're having difficulty because you're short of breath, or it just feels you feel heavy and you just have trouble moving. If that's not the case and you're otherwise very healthy and managing those things well, I think just if it's from deconditioning or from not exercising and moving very much over a long period of time, or sometimes even a shorter period of time, I think just starting in very small bouts, trying to, like I said before, moving a little bit more in your home, going for a 2 to 3 minute walk and kind of working up to a 10-minute walk 3 times a day, maybe. Just moving more will have an impact. It doesn't have to be an hour of walking every day. Just doing a little bit more every day will have an impact.
Oh, that another great question. Does walking my dog count?
So I get this asked a lot. It depends on how much your dog sniffs. Walking my dog does not count for me because she stops every 10 feet. However, if your dog is good, or you can walk your dog around a track, or maybe there'll be less things to smell, or you can get your dog really going. It might be, but I would categorize walking your dog more under that physical activity domain. You're moving, you're not sitting, you're doing something, versus exercise. You want that sustained sort of repetitive movement that gets your heart rate up. So it probably is more of physical activity than exercise.
Okay. And there's another great one. My senior center has many exercise classes for older adults. Are those also good for people with Parkinson's disease?
So many times, yes. I think that a lot of senior centers have really good programs. There is some benefit to identifying programs specifically for people with Parkinson's in terms of exercise, because generally they target areas that people with Parkinson's have difficulty with. So whether it's more of the posture or some specific muscle groups that benefit from being strengthened in Parkinson's specific classes can focus more on that. However, people with Parkinson's can participate in any type of group as long as it's safe and frankly challenging. That's more of, sometimes the problem is when you want to make sure you're enjoying it and it's challenging so that you're getting benefit from it.
Right. Oh, absolutely. And then let's see. I'll just take a couple more questions here before we wrap up. Again, I want to begin an exercise program. Where should I start? I mean, you had some great tips for this.
Yeah, I think just starting small, sticking the sneakers on in the morning. The American Parkinson's Disease Association puts out something called the Be Active booklet. So if you go to their website, you can go to publications and download that booklet. They can also send you out a hard copy, hopefully in the next couple of weeks. Right now, they're not in the office to do that. But so that as a booklet that has some really great, I should say I helped write it, so now I'm promoting it, but disclaimer. But it does have some great exercises and that are easy to get started with, and then just get outside and start walking for a few minutes, a few times a day.
Yes. And we had a couple more questions, again, how do I encourage my father with Parkinson's, to get out and exercise? How do you motivate someone? And again, you had some great tips on, I think you said just starting small and working your way up, but just putting those sneakers on, you had mentioned.
Yeah. And another thing to consider is that the Parkinson's, one of the non-motor symptoms is apathy, which is sort of a disinterest. It's distinct from depression, but it makes it hard to do sort of everyday things that you were interested in doing before. So to that person, I would say, just keep at it, because it may be what's needed to support your parent, is to give them the support and encouragement to get out there, and that's okay. We don't call it, we call it support, not nagging.
Right. I like that. And I just had a couple people ask about how to sign up for Newfound Lodge that I had spoke about at the beginning, and how do you set up a virtual tour. I would just encourage people to call me. My direct line there is on the screen, 603-590-4003. I can certainly set up a virtual tour, and send a brochure and go over any of the information with you as well. And again, we have one more question. And this is, I have trouble walking because of freezing. is there anything I can do? And I know we saw the lines there that you had mentioned. Is there anything?
Yeah. I always recommend people talk with their neurologist, because there is some freezing that, depending on when your freezing occurs, that can be helped with some medication adjustments. So I'd speak to your neurologist if it's relatively new. If not, physical therapists with expertise in Parkinson's can give a lot of tips and tricks to freezing. It's hard to fix it, but there's a lot of ways to work around it and strategies to make it better.
Oh, that's wonderful. And I just was also going to just ask you a quick question about, you were on the board there. You do a lot of presentations with the Parkinson's Foundation. Is that something that people could go to also, find resources as well?
Yeah, absolutely. So thank you for bringing that up, Kelly. I sort of work closely with the American Parkinson's Disease Association. And so over the last 2 months, they've been really putting out a ton of informational webinars. So they have Dr. Gilbert has put out a bunch of them. Actually, the director of the center I work out, Dr. Terry Ellis, has. And then myself and the other team of physical therapists have been doing weekly webinars during COVID-19 to give tips for exercise and how to get involved in exercise. And some of these, some of the things I talked about today are covered in there as well in a little more depth. So those can all be accessed from the APDA, American Parkinson's Disease Association website.
Okay, that's wonderful. Yeah, I think a lot of folks struggling, with all the gyms being closed and, formal exercise programs. So it's just great tips on, how to start an exercise process, regime at home.
Yeah. And if you email me at the rehab@bu.edu, I have tons of resources on virtual programs. So yoga, Tai Chi, a lot of information if people are interested in that.
Okay. Well, that's wonderful.
All right.
We're so happy to have you with us today. And, thank you so much for sharing your knowledge with us.
Oh, thanks for having me. It's been a pleasure. And I hope to hear from some of you listening. If you have any follow-up questions or want to discuss anything I presented today, or just need some support getting started, would love to help with that. So thank you for having me, Kelly. This has been really fun.
Oh, thank you. And again, we hope to have more programs with you in the future here at RiverWoods Durham. Thank you.
I'd love that. Okay. Take care, everybody. Thank you.
All right. Thank you. Thank you for joining us.